Occasionally, law enforcement or other first responders may be required to operate in high-risk environment, requiring them to wear a combination of PPE which provide full body and respiratory protection. There are 4 standard combinations of PPE referred to as Level A, Level B, Level C and Level D protection. In this video, we will look at the procedure for putting on Level C protection as well as the procedure for its correct removal using dry decontamination method. Level C protection will normally consist of a chemical-resistant suit, full-face or half-face respirator, chemical-resistant goggles, gloves, and boots. Remove any footwear and tuck any long pants into your socks. Carefully select the correct size of chemical-resistant suit. If the suit is too small, it can rip, split, or not allow you to have free or functional movement. Put the suit on starting with the leg, and the PPE should always be put on in a clean environment. Put on a pair of nitrile gloves. This will be referred to as your inner glove. It is important to remove any jewelry such as rings to make sure that the nitrile glove will not be snagged. Insert your arms through the sleeves and lifting the suits up your shoulders. With assistance, tape the socks to the suit. Make a tab on the tape itself to help in removal of the tape during doffing. With assistance, tape the inner glove to the cuff or sleeve of the suit. At this point, it is recommended to put on your respirator. Hold the straps, then place your chin into the chin cup at the bottom of the mask. Position your mask onto your face as you pull the straps over your head. Then, you should perform a fitting test. This is done by tightening the straps, followed by putting on the goggles and tightening the straps. And by covering the front of the canister with the palm of your hand, taking a sharp breath in and hold it. If you have an effective seal, the mask should remain suctioned to your face. Pull the hood over your head and zip the suit up to the top. Now, put on the outer glove. The assistant should perform a fit check, making sure the gloves are fitted correctly. With assistance, tape the front flap of the coverall. The assistant then should ensure the hood of the coverall is over the edge of the goggles and tape the hood around the mask. This ensures the hood is properly sealed and prevents from the hood pulling away from the mask. Lastly, put on the chemical-resistant boots. Stretch yourself to confirm the suit is fitting well before you enter the workplace. You are now ready to enter work environment. Level C protection suit offers liquid splash protection but no protection to chemical vapors or gases. When you have been operating in a contaminated environment, the external surface of all PPE items worn must be treated as contaminated. Decontamination methods shown are what are called as wet decontamination. For level C PPE, method of dry decontamination is more suitably used. To remove the PPE, stand in a designated decon area or inside a decon bag placed on the ground. Remove the tape from around the hood mask and the front flap. Open the front flap and unzip it. The decon officer should then remove the hood from your head, turning it inside out as they remove it and roll it downward. Remember not to touch any outer surface of the suit. When rolled until the waist, officer should hold each sleeve and you should pull your hand and arms into your suit. Cross your arms over your chest and keep them in this position. Once the suit is down below the knees, sit down on a clean surface. Officer should then remove the boots. Remove the tape and pull your feet out of the suit while the officer holds the suit in place. The goggles and respirator can now be removed and be decontaminated. Finally, your inner glove can be removed. Once all PPE has been removed, you should always wash your face and hands before drinking or eating. All of disposable PPE should be put in a HAZMAT bag and be disposed of correctly. For reusable PPE, rinse the PPE thoroughly with an appropriate solvent or decontamination solution recommended for the specific hazardous materials. Then, rinse the PPEs again with water to remove any remaining cleaning or disinfectant solution. Inspect the PPE for any signs of damage and, if damaged, discard it appropriately. Store the clean PPEs properly by following the manufacturer's recommendation for storage conditions.